Welcome back to WCI-TV, sponsored by Tower MSA Partners. I'm Amy Sweezy, and joining me now is Nicole Usher from Enlyte. Nicole, thank you so much for being here.
Thank you so much for having me, Amy. Pleasure
So
to be
first of all, what do you do for Enlyte?
Certainly, I'm Senior Director of all of our operational leads for the specialty network. So durable medical equipment, physical medicine, diagnostics, home health services.
And for those who don't know, what does Enlyte do?
Enlyte is an overall technology. They do nurse case management, technology platforms for workers' comp and auto services.
Okay, perfect. So we're going to talk about home health shortages,
yes,
because it is a big concern. How is this shortage affecting services and also injured workers?
Certainly. So we're seeing delays across the board when it comes to home health services, and it's exacerbated by the entire post-pandemic, situation. So we are seeing delays of up to a week, sometimes month, in getting the proper specialty services engaged in the home. So it is impacting injured workers with getting the care that they need right away.
Does this have an impact on things like litigation and cost as well?
Absolutely. So anytime there are delays, it introduces, or at least opens up, not in every single case, but it does open up the opportunity for additional litigation and additional cost.
So the shortage is a concern in a big way. What are some of the top needs in home health? Like specialized skills?
Exactly. So specialty services, wound care, respiratory therapies, any of those specialized services, we're seeing those shortages significantly.
And what do you think, should be the top thing that you're looking for when it comes to choosing a home health network partner?
Absolutely. I think the important thing here is data-driven analytics and getting to a point where, with a provider or a network that is accessing all of the early indicators, where there are going to be shortages, those kind of things, and using those to your benefit so that you don't see those delays when it comes to your injured workers.
So what's the answer?
The answer is getting a strong network provider, right? Like an Enlyte Specialty Network Services. Here at Apricus, we're already doing all of that. We're analyzing our data. We understand where shortages are so that we can direct your patient, your injured employee, directly to the best possible service provider.
Okay, I also want to chat with you about the diagnostic shortages in workers' comp as well. Which of these shortages are affecting the workers' comp cases?
So this is prevalent, and it's becoming more and more of an issue as we continue to keep seeing. So radiologists, there's a lot that we're up against with burnout with radiologists, with just not having a number of radiologists to do the interpretations of the scans. So MRIs, CTs, those are significantly impacted overall.
And how are the shortages then impacting the actual injured worker?
So initially, you need to understand what the actual injury is. So if you can't get proper diagnosis in order to be treated, you don't have a treatment plan, and it delays the overall return to work opportunities quickly.
And is the cause of the shortages, is that COVID related? I feel like a lot of times we talk about that, or are there other causes?
I think it started there with, with COVID and seeing some of those, but then now it's burnout and just not having the overall opportunity or the need. We have an aging population, which puts a demand overall in the radiology space, and then just having the opportunity. So there are things that we can do to combat this, but there are a significant amount of shortages just due to post-COVID burnout and lack of radiologists being available.
So what is the response? How do we get over these shortages?
Certainly. So I think that there's a significant amount of research trying to understand how we can do that. Part of that is having mobile radiology clinics that can go out to certain areas, so that we're starting to see that on the rise. We're starting to see teleradiology, so that even if they're not located in the same area as where the scan was done or performed, that we can still have access to radiologists to read the scans.
All right. Are there some strategies to mitigate the diagnostic delays?
Again, it's a good partner. It's really having a good partner that understands what's happening in certain regions, understand where shortages are, and this is a twofold. So it's not just about getting the patient seen quickly, but also being able to have a radiologist available to read the scans. And reading the scans is as important as getting them in for the initial study. So both of those things, having a good partner, a network provider that can get you to where you need to be and where your patient needs to be, is critical.
So with all of these shortages that you see in your business, what would your advice be to young people or people who are thinking about a career in this field?
Interesting enough, I have a daughter who just graduated and she is going into radiology. So we, in understanding the shortages, understanding the demand and the needs, there is a good opportunity for people entering the workforce to truly get into a space that will be thriving. So my recommendation is complete schooling, and sometimes it's not even a 4-year degree, it can be a specialized, a 2-year program, and you start out significantly in demand and ready to hit the ground running.
All right, Nicole Usher from Enlyte, thank you so much for being here.
Appreciate the time, Amy.
Thank you for sharing your story.
Thank you.
All right, you are watching WCI-TV, sponsored by Tower MSA Partners. I'm Amy Sweezy, thanks for watching.